Welcome to the WRAL Daily Download. I'm Grace Holland. North Carolina identified its first measles case as cases rise across the U.S. WRAL health reporter Grace Hayba is here to explain what this means for our area. Grace, thanks for being here.
Of course, happy to.
So, is it a surprise for us to have this case given the outbreak that's been going on for quite some time now?
No, it's really not. And this is something that we as a station have been monitoring and following for several months now with that mindset. It is just a matter of when, not if, North Carolina was going to see a measles case, if not several measles cases. And that's now where we find ourselves with yesterday, the state health department officially confirming that, yes, North Carolina does have at least one confirmed case of measles for 2025. So it's not a surprise, and, it's something that officials locally and statewide have been looking out for and are now even more alert of.
And where was this first case, and what do we know about it so far?
So the first reported case was in a child in the Greensboro area, and what we know is that child had just returned from traveling in another country where outbreaks had just started occurring. Beyond that, the health department said that it wasn't going to get into specifics about, things that might be used to identify the child for obvious reasons. But what they have said is that this child, after getting sick, did go to several public places. And so that is really where some of the concern now is lying, and a lot of this public notification and awareness and the efforts behind all of that lies in terms of just how contagious measles is. It stays in the air and on surfaces for a while after someone who's infected has been there. So they are letting people know that if you were at, I think it's 8 different places in the Greensboro area and surrounding areas, they have a full list, and we've linked to that on our measles coverage we've linked to that in our measles coverage both Wednesday and Tuesday when the case was first announced. So if you have been in that area, it's definitely worth going to our website and looking at that extensive list. They've put times as well when the child was there. So they want you to be aware if you start to feel a little off that, hey, if I was in this area and now I'm starting to feel a little sick, or my child's starting to feel sick, it could be measles.
So you mentioned that it can last quite some time on surfaces. Is that the main way that this spreads?
Yeah, so it's kind of a mixture of both, like respiratory droplets. So if someone's coughing or sneezing who's infected, obviously, just like a lot of other respiratory viruses, that's how measles can spread too. And inhalation, from someone who is on the receiving end of those droplets, that is how it kind of goes from person to person. But like you mentioned, the virus can also live on surfaces for quite a while, up to 2 hours, if, after someone leaves that area. And if you touch something, a handle even, a table that someone was on, a glass, all of those types of things can transmit the virus. So again, going back to all of those different locations that the state has been upfront about, hey, this is where this child was during this time, that is why they're doing that, and why it's so important for the public to be aware that, yes, right now we are at one case, and we certainly hope that it stays that way. But again, because of how highly contagious measles is, it is not unlikely that we will see more cases in the coming weeks.
And what are the symptoms of measles?
So the symptoms of measles mimic a lot of other respiratory viruses, which is, again, why doctors say it's so important right now for you to be extra aware of if you are in these spaces and just have that at the forefront of your mind, because it's so easy for all of us. We're outdoors right now, right? Some of us may have allergies. If we start having a little sniffle, it might not be the first thing that we think of, right? But with measles, if it is measles, it's really important for you to be isolated as soon as possible, because it can be extremely serious and there is no real treatment for it. So getting on top of those symptoms early on, that can be something like a fever. It can be a runny nose, watery eyes. A lot of those things can develop before the rash that is so signature with measles does. Bright red rashes kind of all over the body. You see it a lot on kids. And so even days before that rash can appear, you can start to experience symptoms. You can be infecting others. And if you're not aware that measles is now in our area, you might not think of that immediately, obviously, because it's been a while since we've had this happen. So that's, again, why not only physicians themselves are trying to remind the public to be aware, but they internally are doing a lot more training in terms of what to look out for. And so that doctors, if they have somebody, or nurses, frontline clinicians, pediatricians, urgent cares, if they see somebody come in their doors with these types of symptoms, that they start to, think, hey, where have you been? Have you been around somebody that, has measles? Have you traveled to an area where outbreaks are occurring? And they start kind of having those conversations early.
Gotcha. Okay, let's take a quick break right there, and we'll be right back. Grace, before the break, you were talking a little bit about how health officials and doctors are, preparing their staff and other clinicians just in case they come into contact with these cases. How concerned are state health officials about this becoming a full-blown outbreak?
Yeah, so right now, North Carolina is in a good spot, right? I would want to start off with that. Yes, it might be very scary to see, oh my gosh, measles is in the headlines, it's here. But again, this is something we knew was going to happen. It was just a matter of when and where, and now it's here. But doctors have been on alert, and they've been telling folks about it, trying to increase vaccination rates. When it comes to how concerned state officials say that we need to be, it depends on where these cases start to spread, if they do. The concern lies in a lot of areas within our state that are not at this 95% marker. You hear us talk about that a lot. I've been on here talking about other viruses as well, and we've mentioned this 95%. That's something called herd immunity. It's essentially when enough people in the community are vaccinated against something, it helps protect those who are not fully vaccinated for it against future spread. So it limits the ability for something like measles that is so highly contagious to infect a lot of people. However, at the end of the day, even if you have 95% of a classroom, for example, vaccinated, if you have a few kids who are in there who are not vaccinated, they're still going to get sick because of how contagious measles is. So ultimately, we're not at this point where it's a panic, right? That's actually the opposite of what doctors want us to do right now is, to not panic and just to be aware. And if families are listening and haven't made the plan to be vaccinated, you're an adult maybe and you're not sure what your vaccination status is, because that can happen. This is mostly a childhood vaccine. Go back through your immunization records, see if you've been vaccinated. If not, talk to your doctor about, hey, I'm really not sure if I was vaccinated as a child, do I need to do it again? And start having those conversations with your trusted family physician. And if you had a child, maybe during COVID, they haven't been vaccinated for measles and gotten the 2-dose series, it's really important, especially for upcoming travel before the new school year starts, to start having those conversations and to ask your doctor and your child's doctor if you have these questions about, hey, is this vaccine safe? What is it going to do? What does it mean? Why is it important? And things like that.
And for our hospitals and emergency rooms, how are they preparing for people to come into their waiting rooms and everything like that?
Yeah, so they, again, have been increasing just awareness within the staff themselves because, like I mentioned, it's been quite a while since we've seen several cases. Our most recent case in the state was in 2024, and it was just one. And before that, you had to go back to 2018 before you saw some more. So it's there's a lot of people working in clinics and hospitals and things who themselves have never had to directly treat someone with measles. So that's where that frontline awareness starts to come in. Again, as we mentioned, if you're talking to a patient who has had some sniffles, had some things going on, has been traveling, maybe to somewhere like Texas where we know these outbreaks really originated, that they have that light bulb moment and start asking those questions early on to say, is this patient a suspected measles case? And if so, they actually have these different rooms where they can put patients that they think might have measles into, where the air in the ventilation system is different, so that the air that patient is breathing in that room is not then sent out kind of in a central AC unit, so to speak, right, through the rest of the hospital, where it could get not only other patients sick, but other staff members, right, or something sick too. So they're aware of that, and they want you, if you are sick, to give them a little bit of a heads up. If you think you are coming in with a potential measles case, we all know the reality of going to an emergency room might mean you sit there for a little bit. That is not a good thing to have happen when you have somebody sitting there with measles. You want to get them isolated immediately. So if you can, give your local hospital systems and local health officials that you're going to seek treatment from just a heads up of, hey, this is what I'm experiencing. And yes, I have been in these areas and I'm aware that measles is happening. That could potentially be the difference between you, if you do have measles, then affecting, a ton of other people. So if you can get ahead of that infection, then great.
Right. And of course, the other way we talk about getting ahead of infections is vaccinations when those are possible, which, of course, there is a measles vaccine. How effective is that vaccine and who's able to get it?
So the vaccine is very, very effective, and it is the main way to protect against measles. You only need 2 doses and you are protected for life. Again, like we've been mentioning, you mostly get them as a child. So if you're listening to this and you're an adult and you're not sure, check with your doctor and they can advise on the next steps. But most people have already been vaccinated. And in fact, measles used to be so common that anyone born before 1957 or around that time, one doctor with UNC Health, an infectious disease specialist, says that they actually kind of just assume that you already are immune because of how common it was back then. The difference and the reason that now it is more of a concern and we're seeing so many of these cases pop up and circulate pretty quickly is that in recent years, our vaccination rates have gone down, especially among that key group that we keep talking about, which is children. A lot of that stems from COVID and a mixture of vaccine hesitancy, a mixture of misinformation, a mixture of just missing routine appointments, because this is something that's often, brought up by pediatricians at certain age frames. So if your child wasn't keeping up with those doctor's appointments at the time, perhaps it was missed. But this is a required vaccine from public and private schools in North Carolina. However, with that, again, tied into everything that kind of happened around COVID, North Carolina's vaccination rates are not above the 95th percentile. Statewide, according to DHHS data, the most recent data available for the 2023 school year, kindergartners' vaccination compliance rate was only about 93% statewide. So below that 95% marker that we've been talking about, right, for herd immunity. In certain places, like Wake County, for example, very populated, right? It's only at 92%. So you still have these large areas with a lot of people living in them that are not at that 95% marker. So again, when you think about kids as they're out right now, over summer, engaging with one another, planning to go back to school, that's where that risk lies in terms of are kids traveling to areas where outbreaks are happening? Have they been to other areas where people who are infected have been? And if so, are they then developing symptoms themselves and further spreading it to maybe their friends, right, who are not fully vaccinated? So again, it just all goes back to the push to get people vaccinated and to really help get ahead of a potential outbreak, because we're not at an outbreak stage yet in North Carolina, and that's the goal of these public outreach efforts, is to get ahead of that and to hopefully not have that happen.
All right. Well, thank you so much, Grace. We appreciate it. And thank you for listening to the WRAL Daily Download and for making us part of your morning routine. Another great way to get WRAL news is the Morning Briefing newsletter. It's a daily email with Triangle news, events, and headlines to help you get ready for the day. Sign up at WRAL.com/newsletter.